right, good afternoon, everyone. Can you hear me all right? Is there a microphone here or no? There's a lot of microphones, but I don't know. So we're here this afternoon in this beautiful facility through a partnership between the city and the Children's Hospital of Philadelphia. This facility houses a library, a recreation center, a CHOP clinic, and primary care clinic operated by the Philadelphia Department of Public Health. These clinics offer high-quality care to anyone who needs it, whether they have health insurance or not. But they depend in large part on funding from the Medicaid program, which is now threatened by the Trump administration. We're here today because the new administration in Washington wants to repeal the Affordable Care Act, which is also called Obamacare, although I don't think people understand they're the same thing because Obama's name's on it. That battle can feel a long way away, but it's a very real for Philadelphia. In fact, for many residents of this city, the Affordable Care Act is the only thing protecting them from life-threatening illness or financial ruin. Today, we have experts who will explain why. The Affordable Care Act provides health insurance for 220,000 people in Philadelphia. That's 1 in 6 adults in the city. Today, those 220,000 people can go to bed at night without worrying whether they can see a doctor if they get sick. Those people also don't have to choose between paying their medical bills or paying their rent. And they have the security of knowing that if they have a chronic illness, a quote-unquote pre-existing condition, they won't lose their health insurance. The President and the Republicans in Congress want to take that all away, repeal, and apparently not replace. The repealing the Affordable Care Act will strip health insurance away from those people. It will mean thousands of people will suffer unnecessarily from medical illnesses. It will mean that many people in Philadelphia will go to hospital emergency departments only when their symptoms become unbearable. And then it may be too late. And it will mean that our key hospitals and other health care providers will financially struggle caring for people without health insurance again. The number of people helped by the Affordable Care Act is enormous, and each one is a real person dealing with his or her own real problems. So today, besides talking numbers, we are going to introduce you to a resident of Philadelphia who has obtained health insurance only through the Affordable Care Act and who stands to lose it if ACA is repealed. That person is Adrienne Gunter, and she will speak next. After she tells you her personal story, I will turn it over to the health commissioner and other experts to explain more about how severe the impact on Philadelphia would be if the Affordable Care Act was repealed. Before I do, let me make one point. People who are healthy and well off can always get health insurance coverage in this country. What the Affordable Care Act does make sure that health insurance coverage isn't only for them, but it's also available to those who are less fortunate. That is people who don't make a lot of money, or people who are already sick, or people who might become sick. This is the wealthiest country in the world. Other countries with far weaker economies than ours provide medical care for every single resident. And the Affordable Care Act showed that the United States can cover everyone too. We owe it to those people who are less fortunate not to take this coverage away from them. And if you've noticed, or if you've been watching the ongoing news accounts of some of these town halls in Iowa and some of these places that wanted to make America great again, they don't seem too happy. As a matter of fact, there's an older gentleman was quite animated yesterday on MSNBC about the fact that he had a pre-existing condition, that he got health insurance through ACA or Obamacare, and that he was worried about living, and told Senator Grassley that they were going to create a death panel, which is what they used to talk about before. And I just one in closing, kind of comical but not comical. Jimmy Kimmel, I like to switch around stations at night. They had a guy on the street interviewing people whether they liked Obamacare or whether they liked the Affordable Care Act. And the consensus was that Obamacare is terrible, but I like the Affordable Care Act. There's been a lot of hoodwinking and a lot of stuff that's been going on. As I said in my prepared remarks, this country can afford to be decent and compassionate to everyone. We have some of the best, if not the best, medical facilities in the world in Philadelphia and the Philadelphia region. We should be able to take advantage of that care and not bankrupt them at the same time. So I want to turn it over to Ms. Gunter now, and who's going to? Oh, Dr. Farley, I apologize. It was in my notes.
Hi, good afternoon. I'm Tom Farley. I'm the Health Commissioner for Philadelphia. There are a number of people who are going to speak today about the impact of the Affordable Care Act and the repeal of the Affordable Care Act on the entire city. We want to start with the story of the impact on one person. Adrienne Gunter is here. She's a graduate of the University of the Arts in Philadelphia with a BFA in writing and film. Her dream is to be a writer, and she has struggled with multiple sclerosis. And she's going to talk about her personal story.
Thank you. Hello, everyone. How are you? My name is Adrienne Gunter. I'm 32 years old, and I have multiple sclerosis. Multiple sclerosis is an autoimmune disease that attacks the central nervous system. Science doesn't know what causes it, but scars, known as lesions, attack the brain and the spinal column. These lesions interfere with nerve receptors and make everything difficult. I need help to walk. I walk with a cane, but it's still hard to pick up my feet. I need help to get the lid off a jar of peanut butter. I need help making my own meals. And even if I chew all my food, it's still hard to swallow. It's also hard to breathe. I have gasped for air, and I've been terrified I wouldn't breathe again. I have all of these problems and then some. But the most important thing to remember is that there is no cure for MS. And yes, I graduated from the University of the Arts in 2013. Thank you. It was the best 4 years of my life. I loved every second of it. So, imagine my surprise when this disease struck me down my senior year. Suddenly, I'm exhausted. Suddenly, I'm not turning in my homework on time. Suddenly, I can't focus. Suddenly, everything becomes confusing and I don't understand what's happening. Nevertheless, I graduated. And as I'm applying for internships and trying to get my career together, I lose vision in my left eye. And my neuro-ophthalmologist, $400, by the way, without insurance, my neuro-ophthalmologist said, you have to get an MRI. This is the first sign of multiple sclerosis. And of course, my life came to a crashing halt. I became instantly unemployed and unemployable. I have $68,000 in student loan debt. I was denied Social Security disability because I haven't worked long enough. My father passed away in 2009, so my mother alone takes care of me. Bless her, please bless her. She does not have to do that. So, what's more, I wanted to go to grad school and get a master's degree. That's not going to happen now. I spent 2 years applying for insurance. Not just insurance, but government assistance. But I was denied 4 times. It wasn't until Governor Wolf signed the ACA's Medicaid expansion that I was finally able to get insurance. But by then, the lesions in my brain had migrated from my midbrain to my hindbrain. And now I have 2 lesions in my spinal column that, if left untreated, can lead to total and permanent paralysis. I already feel like a burden. I don't want to become an invalid. There is no cure for multiple sclerosis, but there is treatment. But treatment doesn't repair the damage. Those lesions aren't going anywhere. But treatment can prevent new lesions from forming. My first treatment was covered through the ACA's Medicaid expansion, but without coverage, those treatments would have cost $5,747.75 for 12 doses per month. Medicaid covers my doctor's appointments. Medicaid covers the MRIs that track the progression of this disease. Medicaid also gives me hope that if I have a reaction to my medication, if I fall and break my bones, or anything happens that I can't predict, it will be covered, and my mother won't be burdened with endless medical bills. And bless my mother, she doesn't have to do this. So if the Affordable Care Act is repealed, if Medicaid is taken away, then it's the same thing as punishing people for getting sick. I didn't ask for this disease. I don't want it. If I could reach inside myself and rip this disease out of me, I would, but I can't. There is no cure for multiple sclerosis. I'm 32 years old. This is the rest of my life. Thank you.
Thank you. We were talking a little bit earlier and just pointed out that the same disease that Adrienne has that requires her to have health insurance is the disease that prevents her from working, which prevents her from otherwise getting health insurance before the Affordable Care Act. So Adrienne Gunter represents one person. I want to get you to understand that in Philadelphia, there are 220,000 people who have obtained coverage through the Affordable Care Act. That includes 160,000 people who were covered through the Medicaid expansion, as she was, an additional 60,000 who were covered through the health insurance exchanges. That means the ACA, as the mayor said, now covers 1 in 6 adults in Philadelphia. And that matters because health insurance can mean the difference between life and death. There was a study that was published just before the ACA was passed in 2009 and showed that people without health insurance have a mortality rate that is 40% greater than people with health insurance, even after you take into account their income and their health status and everything else. And that same study estimated that in the U.S. as a whole, lack of health insurance contributed to 45,000 deaths per year. So if you take health insurance away, you are putting people's lives at risk. What will happen if the ACA is repealed? What will happen is that people who don't have health insurance will avoid getting health care until their problems reach crisis levels, at which point they'll go into hospital emergency departments. Those hospital emergency departments will become overwhelmed with sick, uninsured patients, many of whom will have conditions that will have progressed too far. Hospitals will be obligated to treat them, even though they're without reimbursement, and that means that in the end we'll have sicker people, higher mortality rates, and a financial strain on the healthcare providers that serve the most people in the greatest need. Now, there are many replacement plans that you've heard mentioned. There is no one consensus replacement plan. And none of the replacement plans, none of them guarantee that the 220,000 people who have obtained health insurance in Philadelphia will get it in the future. Also, none of them guarantee that preventive services, which are at no cost for everyone with health insurance under the Affordable Care Act, will get that prevention benefit as well. Now, there was a plan circulated last week by the leadership of the House Republicans. It was just a sketch of a plan, and it included, in addition to repealing the Affordable Care Act, changing Medicaid into either a block grant program or capping its total funding. This would mean inevitably a cut in Medicaid funding to Philadelphia, which would put at risk not just the people who got health insurance newly as part of Medicaid expansion, but everyone who's covered by Medicaid, which is more than 600,000 people here in Philadelphia. All this is particularly upsetting to me because it is completely unnecessary. The Affordable Care Act is working. People are getting covered through Medicaid or through the exchanges. The covered people are getting preventive care. Their health is benefiting from that preventive care. And the Affordable Care Act has slowed the rise in health care costs. So we can afford to keep the Affordable Care Act, and we can't afford to repeal it. Now, before I turn this over to another speaker, I want to just mention briefly one little element of the Affordable Care Act has gotten little attention. That's called the Prevention and Public Health Fund. This supports the prevention of chronic diseases like heart disease and cancer, but because, through the Centers for Disease Control, because the CDC's budget was cut during these years, it also supports longstanding public health programs. So the Pennsylvania Department of Health and the Philadelphia Department of Public Health, through this funding, does a number of things, including ensuring that infants and children in the city are immunized against measles and meningitis, preventing childhood lead poisoning, investigating and containing outbreaks of disease like problems from Ebola and Zika and antibiotic-resistant superbugs, and preventing the leading cause of death like stroke and heart disease and cancer. So if the Prevention and Public Health Fund is eliminated as part of the repeal of the Affordable Care Act. That'll put the health of everyone in Philadelphia at risk for these public health problems by cutting funding to the Department of Public Health by about $8 million a year. Now, until now, we've been talking about health in general terms without making a distinction between physical health and mental health. But the repeal of the Affordable Care Act is particularly devastating to Philadelphia because of its impact on the treatment of mental illness and substance use. And here to talk more about that impact is the Acting Commissioner for the Department of Behavioral Health and Intellectual Disability Services, David Jones.
Thank you. As Dr. Farley just mentioned, our department actually manages the Medicaid program for people with behavioral health issues. So again, it's whether it's mental illness or substance use disorder. We have right now 600,000 members enrolled. That is more than a third of the population of Philadelphia, right? Based upon when ACA was put in place and the state made the decision to expand Medicaid, we expanded by about 100,000 members. So at one point in time, we're talking about 500,000 people going up to 600,000. But sure. So I'll speak louder because there's a lot of mics, but it seems like they may not be picking up. So and so that's kind of on the public side. But let's also step back for a second, right, and think about it from the private side. There will be more, if ACA is repealed, there will be more than 1 million people that will lose reforms and protections provided under the ACA, right? That will include, but not be limited to, no annual and lifetime limits, potential elimination for covering pre-existing conditions, and we heard about firsthand what that would mean for someone who is covered that clearly has a pre-existing condition. For young adults, would not be able to remain on their parents' coverage until 26, and particularly for our department, the Mental Health Parity and Addiction Equity Act, which requires equal coverage for behavioral health and physical health care. And let me talk a little bit more about that, because what that means is that there has been, based upon the ACA, there has been a recognition that mental illness and substance use disorder treatment are equally important as getting your physical health care needs taken care of. And so what we realize is that it's imperative that the physical health conditions through insurance plans, that they don't impose these restrictive caps on the number of behavioral health treatments, which is what has happened historically. So you could, so a health plan could make a decision that David Jones can only receive 10 visits, irrespective of my need, right? Whether that was a mental health, whether that was around substance use disorder or co-occurring. The ACA has changed the game for hundreds and thousands of people, right? The other piece that I think is critically important is that of the 600,000, and particularly the 100,000 new members that have come on as a result of Medicaid expansion, and this will be my final point because I think it's stark. If 100,000 folks fall off, that means they would become uninsured, right? We don't have the capacity to serve 100,000 people and all of the collateral damage that would cause to their family members. And so I will leave you with this final thought, which is if the ACA is repealed and there's not adequate placement, it really could be catastrophic for Philadelphia.
Thank you. And no one knows better the impact of the Affordable Care Act and its repeal than Ralph Muller. He is the CEO of the University of Pennsylvania Health System, which is a $5.5 billion enterprise that includes 6 hospitals, a faculty practice plan, a primary care network, multi-specialty satellite facilities, home care, hospice care, long-term care, and rehabilitation care.
Thank you, Tom. Well, Thank you, Commissioner and Mr. Mayor, for having this session. As the Commissioner said, we serve over 5 million people. We're very proud that we serve Adrian. She's one of our patients. And the kind of care that we can provide, we provide to hundreds of thousands of people inside Philadelphia. And this bumper sticker, repeal Obamacare, has always been nothing but a bumper sticker. It's terrible social policy. It's time to make sure it doesn't go through. Around the country, not just in Philadelphia and Pennsylvania, this is devastating social policy. We've had the good fortune, this is a major improvement in health care policy since Medicare and Medicaid were passed in 1965. It took 50 years to pass it. We cannot go back on where we've been. So it's important for all of us as we're meeting here today to let everybody know this cannot happen. We have to protect the people like Adrian and all the other millions of people that are being served around the country, the million in Pennsylvania, the hundreds of thousands of people inside of Philadelphia as well. On a daily basis, people like Adrian come into our care system, whether it's inside the city, whether it's in our hospitals in the city of Philadelphia and beyond, whether our sister institution, there's a children's hospital, to get care they otherwise would not have gotten. They were waiting years and years for that. They have personal stories like Adrian, and we cannot let this kind of bumper sticker become social policy in this country. So hopefully all of you will get out there, let people know this cannot happen. Obviously, Pennsylvania made a bold decision a couple of years ago to expand Medicaid. As Adrian has told you, you know about the commitment of the city and its department here, as well as our hospitals. Our hospitals take care of many people. We also take care of people who are uninsured as well as insured, but we cannot go back on taking insurance away from these people and putting people back into the kind of devastating choices they had a couple of years ago. Do you work and try to get insurance? Do you lose that when you're not working and don't have that kind of availability? So it's important for all of us to speak out around the country. I know the mayors are coordinating this around the country. The representatives and the senators are hearing this. Obviously, we have people inside Pennsylvania need to hear from you as well. Senator Casey's been a big supporter. Please get the senator to me as well. It's important for them to hear that this cannot happen. So for all of us, again, now I must say I've been the CEO of Penn for 14 years, but prior to that, I was the CEO at University of Chicago, where I had two colleagues, the state senator named Barack Obama and Michelle Obama. So I go back a long ways with them, and I know their kind of commitment to social justice. Obamacare, as President Obama called it, he was proud to call it Obamacare. There may be confusion out there, but this is his legacy, so let's support it. Thank you.
The repeal of the Affordable Care Act will have an impact on patients. It will have an impact on hospital systems. It will also have an impact on healthcare providers. And here to talk a little bit about healthcare providers is Patricia Aiken, who is a registered nurse and president of the Pennsylvania Association of Staff Nurses and Allied Professionals, a statewide union of more than 8,000 registered nurses.
Thank you, Dr. Farley. My name is Patty Aiken, and I am a registered nurse. I've been a registered nurse for 40 years, although I don't look a day over 30, they tell me. For the last 33 years, I worked at Temple, and most of it I worked in Temple's emergency room, which is a very interesting and exciting place to work. I retired from there this past June. My 40 years as a bedside caregiver, I saw a lot of changes in the healthcare system. But until the ACA, most of those changes were negative, as more and more people could not afford health care. Before the ACA, 45 million Americans, which is a lot of people, had no health care at all. Personal bankruptcy from unpaid medical bills was rampant. Too bad if you got a chronic severe illness or accident because your insurance payments had lifetime caps. Women were charged higher rates than men. People couldn't get any coverage if they had pre-existing conditions, even something like being born with a birth defect. You were born into no health care. Patients had to make terrible choices, and one of those choices was to delay care. The sad and sorrowful result was often that patients came into the ER with simple illnesses that had progressed to dire and life-threatening events. I will never forget one patient I had who was a 36-year-old man who worked as a mechanic. He had no benefits, no health coverage, no sick time. He came to the emergency room because he felt weak and tired and fatigued, and he had a headache. And he just felt like something was wrong. He had to come to the hospital. His blood pressure, when I took it, was an astounding 260 over 160. Most of you know that that's barely compatible with life, and no wonder he had a headache. So while we worked on lowering his blood pressure to a zone that was safer for him, we also sent off his blood work. And sadly, his blood work came back and showed that his kidneys were severely and permanently damaged, which is an all too common result from chronic, elevated, untreated hypertension. He went straight to dialysis, and he would be on dialysis for the rest of his life. But if he'd had a doctor or a nurse practitioner to monitor him when he was well and catch his blood pressure early with some medication, he probably would not have suffered, and there would not have been this extremely expensive hospitalization and long-term expensive care. And it was so frustrating and so disheartening and heartbreaking as a nurse to over and over and over see people come into the hospital with illnesses that their lives were, I don't want to say done. People can certainly make a good life out of a chronic illness, but it sure isn't what they had wanted. And to know that something very simple like some basic care could have stopped all of that, and that those of us, as others have said before me, who have more means, assume, it just seems so unfair. So if they take away the ACA, especially for people working in low-wage jobs who got a lot of support with the Medicaid expansion, they got a little break. So I'm wondering how many people have had a much higher quality of life, or a life at all, thanks to the ACA. When they take it away, if we don't stop them, there will be much increased suffering and death. There is one report that says in Pennsylvania, more than 3,400 people, new people, will die every year. That's the equivalent of a jet crashing every month. Something that we would never tolerate as a country. Why do we tolerate this? Furthermore, it will be bad for other patients because hospitals won't have this improved revenue stream. Most hospitals saw an increase of revenue, and now they're going to see a decrease. How will they make that up? Temple alone, for example, has calculated that they will lose $45 million a year. Where's that going to come from? Staffing cuts, program cuts? Something's going to get cut, and then everybody will wait. All the programs will suffer. People will spend much longer times in the emergency rooms. And that loss of income will devastate the entire city, because that's lost revenue that isn't coming into the city and being used. It's fewer taxes. We need, as a society, to look at our values and our priorities. Is health care a public good, or is it a commodity to make profits for Wall Street and corporations? For the system of Medicare for all, while a system of Medicare for all is certainly the most comprehensive and cost-effective, the ACA was a huge, huge improvement. Those politicians who want to take it away must be held accountable for the suffering and death they will cause. My message is, don't take it away, make it better.
Thank you. As you know, the final decision on this is going to be made in Washington. And here to represent us, who represent us in Washington, the council member from, the congressman from Pennsylvania's 2nd District, Dwight Evans.
Good afternoon. I want to join with the mayor, as well as the councilman and the city controller and anybody else who's on the panel, and to say to you that, in spite of may say that we are winning this issue. And the reason I say that is in December or January when I was sworn in, we did a hospital tour. We started at Temple University. And at that time they was constantly talking about repeal, repeal, repeal. All of a sudden you're seeing things slow down. That's because of you. That's because of you. As it was stated, you need to keep that up. Either use social media, either through protests, either through resisting. It is a combination of factors because reality is setting in because they don't have an alternative. The thing you need to say to them, show us the plan. The reality is they're not showing us a plan. And that's what we're saying. We're basically saying they have no alternative. Now, you pay for my health care and anybody else's health care who works for the public sector. The reality of it is, the fact that we have health care, you should have health care available to you. So we're not taking it lightly. We are fighting. We're using every technique you can think of to get the message across, to explain to people that this is extremely sincere. What Patty raised about Temple University is the part about jobs. They have 8,000 jobs in their health system. There will be a direct effect upon the jobs. I've been to Einstein, Lankenau, University of Penn. All those places will affect in this health center in the city of Philadelphia. So I share with you that we are in this. This is not something we take lightly. Collectively here, and I know the mayor and all mayors across the city of Philadelphia is doing their day of action. That same thing is happening with Democrats all across the United States. We're doing our day of action. So we're joining together to send a message that this is not acceptable. You are the key to this. In my view, you need to keep sending a message. Thank you very much.
So this fight is at the federal level, it's the state level, the local level. Here to talk about the local level, we have the council member from this district, Kenyatta Johnson.
So repeat after me. Do not repeal.
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 You know, I was told I wasn't only coming to a press conference, but I was also coming to a rally and fight against those who want to repeal Obamacare. As a young man growing up in Point Breeze, South Philadelphia, I used to come to this very same Health Center 2, when my family was on public assistance. Years later, when my grandmother was in the twilight of her life, we came to this same Health Center 2, before she went into the hospice. And so this is an issue that's very near and dear to my heart. I want to thank our mayor for leading the progressive fight, not only on this issue, but sanctuary cities, also the Muslim ban, to make sure we keep moving the city forward. I want to also thank Congressman Dwight Evans for also leading the charge in Washington, D.C., and also our city controller for making sure the numbers are right, and also all the stakeholders who are here. But I also want to thank Adrian for sharing her story, because this is not a political issue. This is a human rights issue. And so we want to take all of us to stand on the front line and make sure that Obamacare is not repealed. I think about my niece who has a pre-existing condition. She has sickle cell. I spent many a nights in Children's Hospital when she was a child going through apheresis to make sure her sickle cell crisis that she would go through was addressed. Well, now she's a young lady and she's an adult. If she has these same type of crisis episodes in the future, she will need Obamacare. And so it's important that we continue to maintain the fight, and also to let people know the message is getting out. So when I'm inside the barbershops, in the beauty salons, in the senior centers, they're making sure that as their council person, I'm staying on the front line and advocating on their behalf. And somebody talked about Toomey. When you see them, you let them know we're looking for them. Thank you.
The impact of the repeal of the Affordable Care Act is not just on the health of people in Philadelphia, it's also financial impact. And here to talk about that, we have the City Controller, Alan Butkovitz.
First of all, I'd like to thank Mayor Kenny and Congressman Evans and Councilman Johnson for their leadership and being in the pit fighting on this issue, as well as Adrian, who really did a very eloquent and articulate expression of the human impact of this. This subject has really been covered really great by all the speakers. I just want to comment on one aspect of it, and that is that with the repeal of this, we would lose $500 million, a 3-year, $500 million set of money for behavioral health and substance abuse, which is basically $1,000 a patient over a 3-year period.
And it's ironic that at the time that opioid abuse has risen to the top of the radar screen on health issues, and the concerns that people have about homelessness and whether people will be forced to live on the streets again, it's stupid to remove that funding, because it will have not only a devastating effect on those people, but the entire city of Philadelphia and Center City will feel its effects pretty quickly. So, I know Dwight Evans very well, and if anybody could make a majority out of a minority, I'm sure he will do a great job. I see you got your jacket. Thank you.
All right, anybody here who spoke is available for questions.
What's the best way that we can help? What, if we write letters or call? What?
I'm going to turn that over to Dwight Evans.
Phone calls, Instagrams, Twitter, Facebook, all of the methods. I was at an event yesterday evening in Lower Marion. Must have been 350 people. And they are resisting to what's taking place. And I say that to you because this is not something you take lightly. I'm telling you, there's been an effect from the day that I was sworn in on January the 3rd to where we are today, February the 21st, 25th, whatever it is. The point I'm raising that to you is because the people have to be part of raising this consciousness is to wake people up, to make you pay attention. Health is life or death. It's not something to play with. It shouldn't be for those who just have money and those who just have power and those who have positions. Health should be accessible. So when you say that, just by being here and raising the consciousness first, and then secondly, reach out to your congressperson, voice it, if it's me or whoever it is, because believe me, when you do that, only thing I do is pass it on and say, I just told you 350 people. I was in Lower Marion last night, and what they were saying to me is, fight this fight. That's why I'm down here today. The mayor has taken the lead, him in his office, and I've watched him, see him from down at the airport and some other things that he has done. He's been out there too, and it's going to take that kind of effort. So this is far from over. You can see, if they thought they can get it done, they would have gotten it done. Also, there's a number of Republicans who voted against the repeal. Charlie Dent was one up in the Lehigh Valley area, and Brian Fitzpatrick from Bucks County. So there have been Republicans who have voted. So I'm just telling you, you just got to keep with it and not give up. And that's what we're doing here today, encouraging you.
Yes, ma'am.
I have two questions. First, I would like to know, what will it take for blacks to become more involved, to go out to picket and to get into emailing? My next question is this. What would it take for the people who would be the most affected to start getting on the battle line?
Go ahead, Dick. You do it, Jim Kennedy. I mean, bottom line, you're here. And that's where it starts. It starts with you being here. It starts with you not taking anything for granted. I said last night to the people in Lower Marion, this is our democracy. All of us up here are elected. We got to go through you. The most powerful title in the world is called citizen. Citizen is the most, we're not anointed in these positions, we're elected. So you are the ones who send the message. And don't take that for granted. I'm just telling you, there's this little document called the Constitution. And like it or not, there's limits. And I think the person in the White House found there's a court system. And a court system makes some decisions. So there are things happening. So I'm saying to you this evening, African Americans, non-African Americans, whoever it may be, we need everybody in this struggle. This is not something that's going to be just won by any one group. You're going to need everybody in this struggle.
Let me just say one. I think what senior citizens can do, especially, is to talk to some of your colleagues who think that, for example, I had an older gentleman say to me one time, Barack Obama's a socialist. I said, well, you must send back your Social Security check every month because that's socialism. I paid for that. Well, no, you paid for part of it, and everybody else pays for part of it, and your Medicaid, your Medicare too. So I think what happens is that people think what they get is entitled to, but what everybody else gets is socialism. We are supposed to take care of each other. We're supposed to look, and I know that's not in vogue today, and that's not in vogue. People running around with the red hats, they don't think that that's something that we should be about. But we've taken care of each other in many ways over the years, and we got to continue to do so. I mean, public education is a perfect example of something that no one wants to pay for. I mean, the Chamber of Commerce should be the one pushing for public education funding because that will provide a pool of applicants for their jobs in the future. As opposed to worrying about somebody's, pay history bill, I would take care of our kids in our schools. If public education were funded by the state in the proper way, we wouldn't need a beverage tax. Because pre-K would be paid for in the right way. So I think it's sometimes when you have your own cohort of folks who are like somewhat ignorant about what it is they're getting, you need to talk to them and say, listen, in a nice way, you don't have to be compatible with them. We all get a part of this government. Some people at the top get more than others, but we all deserve a little bit of something to get ourselves through. So I think it's that kind of continuing to be a missionary for that issues. And you don't have to be, everybody's angry. I'm angry, I'm worried, I don't know what's going to happen, I don't know what's coming at us next. I don't understand why a state senator from Schuylkill County or Tioga County would care who's living in Philadelphia. Like, we want to get these people out of Philadelphia. Well, send me more. I'll take more of them. They're hardworking people. But remember, and I'm not obviously not an African American, but I will say this because I know enough about the history. Things were bad, man. Really bad. Couldn't sit at a lunch counter. Couldn't ride in front of a bus. Couldn't live where you wanted to live. And all that broke down. That got fought back. That got fought back and made right. Not perfect by any stretch of the imagination. We still got a long way to go. But when you look at the 1930s and 40s, what happened, what Dr. King and all those other folks did in the 50s and 60s, that took courage. He works with John Lewis. Yes. I mean, that man's an icon. I mean, he's got the scars on his head to prove it. So people can overcome when you try. And just don't give up and don't let them win.
Now, the mayor needs to leave in a minute. I just want to make sure that the media have an opportunity to ask any questions before we close out. Any media questions? No. I think maybe we have time for then just one more question, then we're going to call it. Yes, ma'am.
I need to stand up. As an activist and a home care worker, I'm learning how to be an activist. It just bugs me. It's just a statement that under the Affordable Care Act is not properly addressed that home care workers are actually that farm plant and that contract. And I think that it's so important because I say if you look around at everyone in this room, if we keep on living, people like me or some of my colleagues may be the ones that have to take care of you. And I think it's so important that people become aware of that.
That's it. We need to go. Thank you all very much for coming.
Show me what democracy looks like.
Fine. Thanks for coming.